Hello, my name is Logan Ferguson, and my article discusses the pharmaceutical marketing challenges and unknowns. This article relates to healthcare communications and demonstrates how to maintain a proper relationship between doctors, patients, and marketers. Pharmaceutical drugs are standard in the United States healthcare system. When watching TV, how many pharmaceutical companies run their advertising during an hour-long show? 2, maybe 3, possibly 4. Advertising for pharmaceuticals is huge business for the United States and the healthcare providers as well. This case study will discuss how advertising for pharmaceuticals is categorized and some of the unknown dark sides of the pharmaceuticals as well. Pharmaceutical companies and healthcare providers work synonymously together to help provide the best care for patients today and moving forward. Pharmaceutical marketing has transformed and has been broadcast on all types of mediums throughout the years. With the increased mediums over the years, advertising has reconfigured how to reach their customers to provide the proper information. During COVID especially, this has changed drastically, and it states that the medium was inflated with numerous pharmaceutical drugs. So the key to keeping this particular instance from a distraction is they suggested to limit the digital input and focus on one channel that uses analytics and measured insights. Marketers have the script turned around over the years in digital marketing because they are seeing more healthcare providers and less information about the product than the salespeople. With the internet at our disposal, any point of view can be made by an article or post on the internet. Now, whether the research and investigating into that problem was valid or not, there's an abundance of information about pharmaceuticals that is true or not. Including COVID, everything has been politicized and divided with the information that's presented to the customer. In marketing, the In Touch Group article shows that the marketing is having new barriers, ongoing care, limited access, lack of clarity, and unforeseen impact due to the ongoing pandemic. In the article, The Dark Side of the Farm in 2020, it is stated that Americans spent $330 billion on prescription drugs in 2019. Also, nearly 70% of the population is on one prescription, 50% take 2, and over 4 billion prescriptions were in the year of 2011. This also poses an ethical problem as well too, stating that in the early 1990s and 2000s, it demonstrated with direct-to-consumer advertising, pharmaceutical sales influence, and gifting to doctors. With the rise in customer empowerment and demanding personalized approach towards their specialized pharmaceuticals, it is important to channel a single marketing channel for that reason and enforce trust in the triangle of doctors, blockbusters, and sales force. Now, we will discuss a problem that has arose from these issues and how we're potentially going to fix that problem. One problem that occurred during the pharmaceutical advertising era reached its peak in 2015. It states that Turing Pharmaceuticals raised the price of HIV treatment medication from $13.50 a pill to $750. That is a 5,550% markup. There was no reason for the markup, and this just demonstrates the free range of Big Pharma and how they basically operate. Also in the article, it says that 90,000 sales representatives. It says that they employ 90,000 sales representatives and spend $15 billion annually on selling activities, which is another word for lobbying, in my opinion. To help pharma marketing's campaign, they have started moving towards entertaining and engaging content, including a few examples for the products you see on TV for Hims and Roman, and that helps issues for men with erectile dysfunction, hair loss, performance anxiety, and skincare. Another issue that came around was Ranbaxy U.S. subsidiary, Ranbaxy USA. They pled guilty and paid $500 million in fines to several counts of selling unadulterated drugs or lying to the FDA about it, covering up their issues. Communication of pharma marketing has changed recently and has become a patient-centric healthcare, brand building, and differentiation. There are multiple ways to combat these issues, and that starts with the patient having a sense or an idea that not all medication is cure-all. The advertising of these drugs is portrayed as a problem solver, but only delays the real problem. Working in the healthcare field has made me worried that all these drugs are prescribed for money purposes or because the patient wants it. With patients being informed of different mediums of pharmaceutical, patients have predetermined notions before coming to the office. That can be difficult for physicians trying to create conversation with a patient who has biases about what they come in and they can't have a level conversation. Instead of pushing advertising 5 times as much on advertising and marketing to doctors, why not actually do research and development for the products so you can create efficiency down the road rather than recalls and liables for lawsuits and keeping patients sick. This is where the money is made with pharmaceuticals, and it's absolutely disheartening what they put out online without the proper information to the public. This would ultimately create a balanced relationship between patients and doctor rather than be a transactional relationship for the doctor or getting what the patient wants. What type of questions would we have after these pharmaceutical issues? Are we actually receiving a pharmaceutical drug that helps or hurts us in the long run? Do we mislead the customer on pharmaceutical drugs to coax them into using them? Will customer empowerment be helpful or hurtful to the future of pharmaceutical advertising? And are pharmaceuticals priced for covering cost, or are they just inflated because of the demand of the medication? To conclude this, pharmaceutical advertising has changed recently and vastly changed how our pharmaceuticals are distributed. With all the unknowns of what's going on in pharmaceutical research and development or marketing, there should be transparency about the product rather than verbalizing at the end of commercials with multiple side effects. Big Pharma is a real thing and holds some people hostage due to the prestige and the size of those institutes. With more information to the public and being able to relate to the patient, this will help pharmaceuticals return to the good quality patient care and not create a decision for the patient based on the price of drugs.